Welcome to Camp Confidential, Beyond the Bars. I'm Katrina McLaren, and with my co-host Cheryl Womack, author, entrepreneur and philanthropist, we tell it like it is. In Season 1, we take you inside the walls of a women's federal prison camp. From pre-sentencing to navigating daily life behind bars, we offer practical advice, survival strategies and insights that no one tells you before you go in. No sugarcoating, no cliches. This podcast is for information and entertainment purposes only. Be sure to do your own research and consult a professional. Today's episode, Your Health, Your Burden, is based off the book How to Go to Camp, Surviving in a Women's Federal Prison by Cheryl Womack, available now on Amazon. This episode will help you understand how you can take a more proactive role in your healthcare while in the penal system. Cheryl, what steps would you recommend someone take before going into prison?
Depending upon your age and your healthcare that you have available to you, I would strongly recommend that you get a complete physical, including the blood work, if you haven't had one in a while. And again, if it's covered under insurance. If you're old enough, I'd get a mammogram. I'd make sure if you were younger that you were current with whatever vaccines or shots you have to have at that point in your life. And I would get a pap smear. I'd go through all those things that you would do on an annual or semi-annual basis. You maybe haven't done them in years. It's a good thing to do to go so you have a baseline for what your health is before you get there.
Yeah, I would think that while you're trying to sort out so many things in your life and get your family organized and everything, it would be very easy to overlook your own healthcare. But I think it would be critical. It should be on the critical list to go get those things updated before you go in. Because the reality is, while your medical is covered in prison, it doesn't mean it's going to be as quick or to the same standard. I know also that when you went in, you made sure that you took a concise list of your medications. So you were allowed to take your medications in with you?
I was able to actually bring my latest round of prescriptions. When I checked in and went initially to medical for the initial tests before I got into the dorm, they took those pills from me. And until they cleared that I could have my own, they kept them, and I had to go to pill line and get them, which took about 24, 48 hours. And then I was allowed, based on the medications that I was on, probably not medications anybody else wants to buy, thyroid, things like that. They just didn't want them. Then I was able to keep my own with me in my own possession.
So is that because you think primarily because you're on thyroid or things like that? Yeah. You're not on a narcotic as such.
I'm not on a narcotic or a pain medication or a hallucinogenic or something somebody else might say, hey, I'll buy that from you. I mean, I don't know that's the reason for it, but I know many of them can't keep their pills, but many can. So it depends upon what you've got. You should have a complete spelling of what you've got, the dosage, how often you take them. If you have taken a certain vitamin for a long time, you might want to tell them. It doesn't mean you're going to get it or get exactly that same drug when you give them those things, but it's a good start for them to see where you've been, and it's a good reference for you to know what you have started with.
So when we first started the episode and you went into prison, you were taken to medical briefly. After then, when do you get your next appointment as such? Because as you said, you were on a list of medications. So when do you see a doctor next? Or do you ask to see one? How does that process happen?
So until you get through the remaining, them checking you to see if you've had your tetanus and to make sure there are any other shots they want to give you, until you can physically see a doctor and get scheduled in on that schedule, get your blood pressure checked 2 or 3 times. Maybe it's because you're older, maybe because everybody's is probably high when they go in. They want to see that it settles down. But what happens is you get a call sheet, and the call sheet is put in the lobby of each dorm at the end of every day for what's going to be on for orders the following day. And so if you don't have access to the computer, or even if you do on the computer, you can look up the call sheet under medical, or actually it's a tab called call sheets. And it'll tell you if you've got appointments, whether it's administrative, whether you might have to see the psychologist. I mean, I don't know what reasons there might be, but any appointments you have, including medical, that's where those will show up till they've done their routine. Then they'll schedule, whether or not they'll give you a colon test with a poop smear thing, and they'll give you one of those to take at some point in time, and they determine what it is by setting you up and having you on call out. You come in and get your test, you go back and handle it and return it to them. They set you up for when you get your dental. If you have an emergency and you are really, really, really ill. So what happens is when the medical staff gets there and checks in, and usually after they've done pill call and insulin call, and maybe before, they give you 15 minutes of sick bay. And basically, anybody on the campus can run to get there and see if they think you're sick enough, because then they're triaging how many people showed up, what's their problem, do they really need to be seen right away? And they'll triage you for that.
Yeah. Just to pull it back to the call sheet for 1 second. So it's in your computer system and it's displayed each night in the dorm. But if you don't show up or are not proactive in looking at that call sheet, you can potentially get a shot for that, right?
Oh, absolutely. Let me tell you, when a CO gets you on their list, because especially in medical and dental, they're tightly scheduled. So they get you on that list and you don't show up, they are very upset. It is a big deal for you not to make those appointments.
Well, which makes sense.
It
So
does too, yeah.
talk me through how, if you're coming to the end of your medication, because you're lucky enough that you're able to store that in your own locker, how do you reorder medication? How does that process happen?
So there's a medical tab, and I think it says meds, and you go into the tab on your computer. Again, if you've got computer access, I think this part would be free that you could get onto. And you go in once a month or however, mine were monthly prescriptions. And so I would just go in you have to give them about a week's notice to get them. And what they do then is that you process it through and say, I'm ready for a renewal of all my medications. It'll ask you, check which ones, and you check them out. Or if you're taking the same thing every day, you check them all. And then in 2 or 3 days, they call you up and have you come up and pick up your medications for the next 30 days.
So that's basically all through the TrueLink system, the prison's own computer system that you're doing that through. You mentioned, just alluded to it a little bit briefly before, that there was pill calls and diabetic calls. What are they?
There are, again, a number of ladies who are not able to maintain their own medication, or they could be medication that they take through injections. So they have to, or it could be liquid, I don't know, or it has to be refrigerated. And so they have to go up and they call a pill line, and they have a pill line and they have a diabetic line, and they have them get in 2 separate lines, and then they'll start one line or the other line to go through one at a time, coming into the nurse's office, and everybody else stands in the hallway, and you go in one at a time to get your pills, get your shot, and then leave. And that happens twice a day, because for some people, they have to take medications twice a day. For diabetics, often they take those at least twice a day.
I know, Cheryl, from reading the book, How to Go to Camp, it did reference in there that you actually, when you went into prison and you saw a doctor, they tried to force you on 3 new medications. So do you have any control? And in fact, they did put you on 3 new medications. Do you have any control over your medical health while you're in prison, or any say with the doctor?
You do and you don't. So I went in, and the very first thing is I am on thyroid. And so a new thing with thyroid for like the last 15 years, is not real new, is T4. And when this doctor saw that I took a thyroid pill for T4, he goes, you and your fancy schmancy doctors, and just says, and I said, in the past, I think I've been pre-diabetic, but I don't think it's been a while. And he goes, there's no such thing. You're either diabetic or. He was very argumentative about everything. And it's like, I knew what my health was. I knew what pills I'd been on. I knew I'd been maintaining a satisfactory level of health. And I told him, I said, look, I came in here healthy, and I intend to leave healthy. And I pretty much got yelled up one side and down the other, and almost got a shot for that. So then he started prescribing me, not because of that, but he started prescribing me other blood pressure pills, some other pills, that an older person would take. I didn't know what to do with them. And so I just held the pills that he gave me when they got renewed with my pills. And I finally went to the male nurse that was there and was crying as usual and said, I don't want to take these pills. I don't know what they are. I don't know what side effects there are. I don't want to take anything but what I'm taking. And he goes, look, you can really get in trouble for not taking what's prescribed. You need to just take them and throw them in the stool. Just when you get them every month, dump them. So that's what I did.
Isn't that crazy? So you were forced on medication. So I'm assuming you didn't actually have high blood pressure, because they would have checked that, right?
Right.
Did they even check it?
Right. And it wasn't just high blood pressure. I just can't remember what the other 2 were for. But, when I have somebody who's challenging my regular thyroid and things like that, I had no confidence in this doctor at all. And I thought, I'm just going to stick to my plan.
So why do you think there's an emphasis to push new medication on prisoners? Additional.
This is all about money. They get to charge the government for any medications that they put on people. So if you're unhealthy, you're a bigger ticket item to them. If you're older and you're reasonably healthy, probably the only way they can put more of a charge on you is to give you more meds. And so I was being prescribed more meds, and I had to take them and go flush them down the stool and throw the thing away. And that's how I handled it. And, I could have really gotten a lot of trouble if I got caught by that doctor or by the medical staff. I said, what can I do about this? Because I'm not going to take these drugs. And if I tell him, I'm going to be in trouble. And you knew you were.
Well, it's not like you didn't try to talk to someone in authority about it and say, well, you weren't comfortable with this. So another thing that's important to remember, that when you go to prison, you are giving up the ability to control your own medical and those aspects of your life. That's out the window, and that's now in the hands of someone else. So you are giving up complete control of your life.
Down to the medications. There was another woman who was having serious medical problems when I came in. And part of I think she had heart problems. And part of the reason she was having serious problems is because they changed up her heart medications and changed it from what she was routinely on. I don't know in general a lot about that, but I have a very good friend who's a cardiologist. And he basically said, when they get your medicine right, when you have heart problems, you just feel great. But if you get those off, it can really be hard on your body. You can really have some problems. And so probably her heart medications they put her on that messed her system up. And she was passing out and having all sorts of problems going on. So they changed things, and they can. And again, I think it was annoying to see. It made you very uncomfortable with a medical system that you have no control over, that if they say you're going to do something, you're going to do something. I mean, imagine if you passed out and they put you in an IV. And, I think normally if you got really hurt or sick, the good news is I think on the occasion I've seen that happen, I've seen the on-site guard load the person up and take them to the local hospital. Thank goodness. So, but if you're in there for treatment before or after you've been for wherever you've been medically prescribed, you're now at really the mercy of whatever they're advising you to do.
And the other thing is they don't have to notify your family, correct? So if you have a medical event as such, and you're taken to the on-site medical centre there, I understand the men's prison and the camp shared a medical staff facilities?
Yes, right. And so you have to remember another thing is that even for the nighttime, when they come for out just before the 10 o'clock count, they're always going first to the men's prison to take care of whatever medical deals they have with that. And if they had more people get sick or they've had more overdoses or any of that, it's going to take them longer. And then they're going to come to deal with whatever they've got to deal with at the women's camp. So it was clear we were always second, which, I mean, they came. I think what bothered me more than we were second was another gal that I'd taken in for surgery. And I think we've talked about a little bit how to get a colostomy bag. And so she's come home, she's got surgery, she's in the RDAP center. She's got to get in a wheelchair and she's got to wheel herself over to medical at 9:45 p.m. at night. It's up a graded hill. It's a pretty good distance when you're wheeling a chair, especially if you're not used to it. It's just to get up there and get back for 10 o'clock count. And if you find a guard who'll give somebody permission to help you roll it up there, you have to do it by yourself. I just found it horrible that the first night you could be there, it's like there might be one or two people in our entire women's system that might need to see a doctor. Why couldn't you come to us instead of us go to you?
Well, at least keep you in medical overnight rather than pushing you back to your own,
I don't care if it's a week later. If I've got a colostomy bag, I don't want to wheel myself up. If I have a broken leg and I can't even get on crutches because it's so hurt, I don't want to wheel me up. I can think of a lot of situations where I just don't understand why. Like this one woman I checked in and took care of her in the bus stop. Her big sisters came in with alcohol poisoning. She drank way too much and was trying to probably drink herself to death because she did not want to come to prison. It was a horrible situation. And she was so sick. They let me help just practically carry her up for a while. And then she had to figure out how to go up on her own. And one time I was coming up there and I was looking at her. And so I helped her walk in because she was passing out. She got yelled at and I got yelled at for helping her. It's, they want you to get on your own 2 feet and be strong, but just sometimes you're sick. And sometimes I get that people are playing the game, but sometimes you're sick.
Well, what about dental when you're in prison? So if you have a toothache or something happens, is there an on-site, do you go, the dentist chair's on-site? Are you taken off-site? How does that work?
The dentist chair's on-site, and they have a dentist contractor who comes in once a week. And so, again, you get those 15-minute emergency calls to come in if you've had horrible tooth pain. Now, what I learned really through the other gals there and through one of the guards is that if you've been on drugs and you've been on meth especially, which a lot of the girls had been, and you've got your teeth rotting out, they're going to wait till most of your teeth come out. They're going to pull them 1 at a time, 3 at a time, whatever it is, until you don't have any teeth and then get you dentures. They're not going to try to save your teeth. Where I have crowns and I had a crown come out, and so I ran around with a big tooth missing in the front doing all my classes for a while. It was horrible. I was trying to figure out how to glue it in with super glue and everything else that I found on the camp thing, but it wouldn't stay, and suddenly you just have a tooth rot sitting in your mouth. But because I had normal regular teeth, the dentist actually molded me a very good tooth, and did that. But it's because I have normal, healthy teeth. And
Yeah.
so I think a lot of them is like, we're not going to throw good money after bad. It was their thought process. And I mean, to take it a step further, it takes a long time when they do order something, not because of the camp, but because of, and I don't know why, but in the system, if you need glasses or if you need dental work or dentures, it takes forever for them to come in. And I don't know enough about dentures, but I know that they have to fit properly or they really can hurt and you can't eat well. And this one gal who was in my dorm, and specifically in my alley, stayed, and I thought, well, I thought you were leaving, Jamie. And she's like, well, I got my new teeth and they don't fit. And she really was one of our destitute, really poor girls in there. And she says, I've just got to stay until they take them and get them fixed and bring them back. So she was there. She was there when I left. She was still there. I think she was there another 2 months.
Outside of the time that she had to be.
Yes, because she needed to wait and get her dentures. So, I mean, again, it's really easy for me to sit here and tell everybody, well, sure, and go get a physical and see your doctor. Well, I'm hoping you have health insurance. I'm hoping you might go to a clinic where you can get some sort of baseline health information, because a lot of these girls have not seen anybody medically for a long time. And it's just, if you have the possibility at all to get any kind of medical information about yourself before you go in there, it's a good thing to have that baseline. It's a good thing to have some general information.
So you going into prison, did it concern you about your health? I mean, you're an older person. You're already 67, 68 at this point. Did that concern you, your health going in?
I think the greatest fear, one of the greater fears that I had there, is that one of the gals who was there who had hurt herself in a baseball game very, very, very badly, did not get proper care for a long time. They basically, the internal doctors argued with the external doctors about what was really broken in her pelvic area, and a lot more was broken and damaged than they thought. So it kept messing things up, and she'd have to have more surgeries. When that happens to you, let's say I get pneumonia or I get cancer or get whatever, you get put on a medical hold. And I just kept going, as an older person, I don't want to, for some reason, have something that suddenly makes me sick. I'm a medical hold and they don't have to let me go. That scared me to death. And I mean, it scared others too. Any of us who were a little bit older were just like, oh God, please don't let us get sick. Don't let anything happen to us. And there are a lot of girls there who wouldn't participate, and really team sports didn't really exist much anymore since that girl had hurt herself a few years before, because of how they saw how that all turned out, because it turned out so poorly for her that a lot of girls said, I'm not going to play and take a chance and get hurt, because if you get hurt, again, if you're close to getting out, you could be there longer. You could end up in a different camp. Who knows what could happen.
So just to clarify for people that have never been to prison, a medical hold would mean that if your release date is coming up and you have a release date, you can't get out until that medical hold is lifted, right?
And the medical hold gets lifted by the people that are treating you medically inside that camp. Not a doctor. A doctor could go, you're free and well to go. You can treat from home. You're going to be good. If your doctor inside doesn't agree with that, that's the person who has to. You have to go through and sign off. And when you're getting released, you have to go through with a card and go to every one of your COs for every division you've been in and sign off that you don't have any fines or anything that's going to hold you up or anything to get out. And medical is the last one.
Well, I would have thought that was extremely nerve-wracking to think. Because what if that person didn't like you? I mean, let's face it, there's personality clashes in prison. And it seems to me like between the COs and everything else, there's a lot of power at play.
This particular guy, I think I'm going to allege and tell you, don't know factually, but I'm pretty for sure that he was on an ankle monitor and doing his own time of having to come take care of us as an on-site doctor. And he did not like us. He did not like being there. He was not nice to us. And, it wasn't just me. He wasn't nice. He was always yelling at the girls. And I didn't
clarify. Sorry, 1 second. Are you saying that this doctor was potentially on parole and as a part of his requirement was to go and give free medical advice in a women's federal prison?
Well, he might have gotten paid, but he might not have gotten paid very well.
Did you see an ankle monitor?
Ankle monitor around his ankle.
Wow.
My first clue.
I'm shocked by that. If it's bad enough that maybe you're not getting the best care, but to then get care from someone who does not want to be there, that's a given.
Yes, because, I mean, if he was a full-time doctor on site, he could be an amazing doctor. Say he got 30 years for doing something. He could be in there and be an amazing doctor. But if you're forcing him in there, this was not a happy man. And so I'm thinking he did not like having to do this at all. And he never came to the nighttime ones unless it was an absolute emergency. Everything was a phone call. And like the girl who had alcohol poisoning and stuff, we'd have to call and then wait for him to call us back with what he thought we should do next, for whatever the next treatment was, or just go to bed overnight and let's see how she is in the morning. And you'd be like, oh my gosh, we have to wait overnight. It would just scare you.
Yeah, of course. I think that's an absolutely natural reaction. One of the great things that I think that occurred during your time while in prison was that as a town driver, you were critical in setting up Mammogram Thursdays. Tell everyone about that.
Well, they used to do mammograms. And so they'd take one or two people and they'd go over to a nearby place and they'd do the mammograms. And so after I got there, then I said, why don't we just take a bigger group of women? And so I would go down to pick your automobile and I'd say, I need the big van. And at first, when I went there, they're just like, they're gruff until they get to know you. And they're like, what do you need the big van for? I said, I'm going to take several girls. You don't get to tell me that. So they have to go get it cleared and you make sure it's all okay. And then they come back and they begrudgingly give you the key and tell you to get it right back to them. And then you load the women up. And basically, that went so well that every other Thursday, we had Mammogram Thursdays. And I'd load 10 to 12 women in. And a lot of these women hadn't, again, been off site maybe for a year, maybe for 3 years, something like that. And so, again, you try to make it a fun experience for them, but a managed experience for them, because even though you're a prisoner, you're sort of kind of in charge of for them or responsible for their behavior. And so you're all going to checking in and corralling herds of cats to try to stay in one place while they take them in for the mammograms, and they could get one or two at a time, but the rest had to sit there with you. But you could go get it efficiently done and come back with it. And it got where it was fun. And it was also fun it finally got to where that gruff guard I'd show up on Thursdays and he'd go, Mammogram Thursdays? And he'd give me my key, so they embraced the idea of it and it turned out to be fine. But it's something like that. I think somebody has to show the initiative. They'd be okay to take several and be responsible for several people, or even suggest an idea. Now, I've suggested other ideas, as many other girls have, and they've been shot down. But this one was picked up and embraced, which was good for them.
So that you weren't required to have a guard go with you. You were able to take the women in one hit?
8 and 10 women. And I was in charge.
But you know what? In another way, I think it's fabulous they allowed that to happen because, let's face it, breast cancer is one of the highest forms of cancer a woman can get. And while you're in prison, these sorts of things you're going to have concerns about, especially as you get older. You're missing out on
drugs. They've been on drugs. So you don't know metabolically what they've done to change their system that could have created some problems for them sooner. So it's really important, I think, to check once you're coming off of any kind of drugs. You probably really need to monitor lots of different parts like that a little more often.
Look, and explain to everyone too that whilst it was great that they enabled you to take these groups, that you still had a duty of care, and each prisoner had a duty of care to everyone else to behave in a certain way, in a certain manner. And if you fall out of line with that, that could jeopardize the program for everyone. Let's talk about that for a second.
I don't think that I would really get in trouble, though I'd probably get yelled at, but I don't think I could get a shot. But when I had a group of girls with me on one of my occasions, then one of the girls said she had to go to the bathroom. And so she went and she wandered outside into the parking lot. And remember how I told you the story of when I walk inside a place for medical treatment, if the male guards are there with a male prisoner, I have to leave, or vice versa. So you can't be in the same place. So male guards are there all the time. So when that girl walked out in the parking lot, we're in our greens because you're not going off site without wearing your prison uniform. And she was going up to different people in their cars, asking them if they had a cigarette, trying to get a cigarette to smoke. For her, she was innocently trying to get a puff of cigarettes. That male guard saw her. She got pulled out, put in the shoe, taken out, and put in county, got in a lot of trouble, lost her place in her bed in her alley, a whole bunch of things. Didn't understand where it came from, didn't see that was even happening because none of us saw the guards see her, but it happened pretty rapidly and it was ugly.
Well, yeah, and it's not like you were aware that that's what she was going to do. And I'm sure she had no idea the ramifications of that.
You should know you're going to get in trouble.
No, but I mean the ramifications for everyone else, that she could have jeopardized that whole program for 8, 10 other women that were going to these Mammogram Thursdays.
Yeah, I think she should have. I'm not going to let her off the hook that easily. But for somebody who's going out looking for a cigarette for themselves like that, they're clearly not thinking of other people and what the ramifications could be. You're exactly right. They're just not considering other people's fates.
No, it seems to me that prison in some ways it encourages you to be quite a selfish place. And so people that go in already selfish are going to be even worse.
Right.
Which does lead me, with the big concern about healthcare. If you get cancer, which is, the number one killer in prison, What are those steps there? Because my concern would be that you're not going to get adequate treatment to be able to stay alive, and it could take so long that you'll die.
The hardest thing that happens, I think, in prison is the diagnostic process. So first, let's say you went and you had a bad mammogram. Well, now you have to get on the schedule and you have to get this internal doctor who doesn't really like us to approve you to go out and have further tests. And I drove a lot of people into Barnes Hospital and other hospitals in St. Louis for further checks for things like that. And sat with some of them, got told they had cancer while they were there, and went through different processes like that. It was horrible. But at least I was there to listen to what was being said, and she's not just having to do it by herself or with a mean guard. So you get that information, and then you come back, and then you wait and you wait and you wait, and then eventually they send you again. And let's say in between those processes, you get a transfer and you might have to go to a different prison. Let's say somebody who was in your group that all got jailed at the same time comes to your unit, and or you get called in to testify against them. They're going to take you off site. And the reason I'm going to there is because now you may not come back to that jail. You may come to that jail. You might have to start the diagnosis process all over again.
Oh my God, that could cause so much time loss.
It did. Let's get into, I had one friend that is actually the girl I replaced for town driving. And she was going to a different camp with a large number of the girls. They were opening up another camp, and they were taking a busload of girls to this other camp. And she'd been diagnosed, and she had been waiting forever to find out what the next steps were. And they never came back and put her in for what the next steps were until she went to Pekin, the new camp. And then they put her in and started her all over again. Now, we could all see that she had one boob twice the size as the other boob. It was just, nobody could miss, there's a problem. I don't know what the problem is. I don't know how bad the problem is, but there's a problem. So I think they finally did a biopsy. And then while she was waiting for the biopsy, when it came back, they decided that she probably was going to be pretty sick. And they sent her to Carswell, which is the hospital prison, in the United States for women and men. And so obviously it was bad enough that they decided they should send her there. And then it took a while for them to do testing and start the process over again. And before she could even get really good surgery and treatment, she passed away.
Wow. That's terrible.
I mean, think about it. I took over for her as town driver. I'm only there 15 months. And before I got out of prison to come home, I knew she was dead. We were horrified. We were devastated. She had been there for a long time. I was really close to a lot of people. And we all knew she was sick. And we just couldn't believe that a person was such an afterthought. There's another woman that I took in to see a doctor, and I don't remember what her problem was, but it was high blood pressure, maybe a heart something. When I brought her back to the camp, the doctor pulled me in, and I'd signed a HIPAA form and said, here's what your next steps should be, and here's what's going on. And so driving home, the woman said, I've been told some of these things before. I don't remember exactly, but I've been told some of these things before, and the doctors don't ever listen to me. And so you can buy a copy card on commissary where you get, I think, 3 copies for $1, something like that. Don't quote me on the prices, but it's a little bit pricey. And I had a copy card, and I said, we're going to go, because as soon as you get back, you're supposed to take your medical records and give them right to medical. And I said, we're going to go, and we're going to bypass medical and go straight to the copy machine, and we're going to copy what you got from your doctor, and you're going to mail them home to your family and keep a copy here. And then you're going to give them to the doctor, because if you have complications from this and they didn't follow the doctor's directions, you might have recourse. You might not have recourse. Now, that's somebody like me sitting there looking, going, this makes me nervous. I just want you to be aware. That doesn't typically happen.
And let's face it, for FMC Carswell's in Texas. So if you are being shipped off there, if you've got 18 months or less to live, you don't automatically qualify to get out. You've still got to go through a process. So if you're sent there in your terminal, this is a really big deal for a lot of people, because your family may not be able to afford to visit. They may not get in to visit. There are so many unknowns with this process that I would imagine that for anyone that's facing this and facing it, it's bad enough on the outside to face this,
Right.
and when you've got family support and loved ones. But to do
Right.
this in prison, where the only group you may know is in your own camp, and then to be moved out of it and have no one, I just can't imagine how heartbreaking that is.
And irrespective of whatever your procedure is, if you go into the hospital for overnight or a few days or something, you might have a guard sitting outside your door. You don't get to have any family come see you. You don't get to tell anybody. So you could have had a pretty serious surgery, and you're still all by yourself. So it is a lonely. And then when you come home, remember, You're in a place of concrete and iron and stone and lots of hard surfaces in a cold environment to heal in. It is your home, and for people, if they've been there for a while, it's what they know is their home, so they definitely would be more probably comfortable there than they would be if they were still sitting in the hospital. But it just was it was to me really sad. It'd be a really sad place to be really sick. I mean, I know when I had the flu, well, the couple times that I got the flu, and the first time in October, after I got in there at late at the end of July, the end of August, I got so sick. And there was nothing sadder than just laying in your bed and feel like you don't have a friend and you have nothing but cold medicine junk to take to just try to feel a little bit better and make the fever go away and just sit there and sleep and ride it out. That's all there is.
Tell me, in the entire time you were there, you've just explained that you had a really bad cold. Was there any other medical event that you had yourself while you were in prison?
I mean, I got a flu shot once when I was there, which I wasn't going to get flu shots, but I thought, I'm so in close proximity, this is probably the time I ought to get one. I got sick a couple times, and the first time was really the worst. And otherwise, I stayed pretty healthy, which is amazing when you think about how many sick people I drove around. But a lot of these people weren't sick with colds. These people were sick. These people were unhealthy from damaging their bodies over a number of years. Well, these people have stopped drugs, so their system's changing and adapting to it, and they had fallout.
Do you think the prison community itself, the other inmates, supported each other with health and medical issues? Do you think that was a real thing or not really?
I think if you had friends there, and most of us would get a pretty close bunkie or a couple of pretty close bunkies. You made close friends. I mean, like I said, even with the mean girls, I didn't get that close with them. But with one of the girls who wasn't in the clique with the mean girls, if something hard happened in my life, she'd always pop in and show up and say, "Are you okay?" And want to see what's going on. And I think when I was sick in my bus stop, there wasn't a lot of concern for me because they were very young kids and I was pretty fresh in there. But a couple of the little older girls started showing a lot of empathy for me, and they had to get me the medication that you could get for flu because I had nothing.
Do you have to buy it through commissary? How do you get that?
You have to buy it through commissary.
So you've got to buy your own medication, in effect, for if you've got a flu or something.
And imagine if you've got a flu and maybe you just come off your day of commissary the day before, you've got till the next week to go again. So you're negotiating around. I mean, usually what we did was we kept little basic supplies of things for headaches or colds or things in our stash, and you could go amongst each other and go, "Hey, I need something. Can you help me out?" So, and trade it off for later because there's no such thing as an emergency there to get emergency relief. So you had to prepare for your own emergencies. After I left, they have this emergency button that you hit for emergencies, like a big red button that's out in the foyer in the dormitory in between all the alleys where the hot water is to make coffee. And after I left, one of the girls passed out cold. And so this one friend I told you that I was friends with who would check on me from time to time, we would talk on the phone after she got out. She said, "Let me tell you what happens when you hit that button. When you hit that button, it goes off in the bubble, which is the guard station up front in the bubble. So it's going off in the bubble. A guard has to answer it by walking down to see what's going on." He was ignoring it because he just didn't think it would be anything. So somebody had to go up there and get him and bring him back, which again, this is not a real short walk. Then when he gets there, we've had somebody push a red button and we have a medical emergency. They're all freaking out. Then he says, "Well, if this is a real emergency, I have to go up and call FCI and they have to call an ambulance." So then he has to go back where he is. And then he basically hits his red button to get an emergency. I mean, if you're having a heart attack, you just die. It's not quick there. And we always thought with that red button, if there's a big fight or something really dangerous, it sort of made you feel a little better that you could just go, "Oh, no, I'm going to hit this button because I'm really nervous about this." And, it didn't even work. It just rings the bubble. And if the guard's out doing his rounds and stuff and he's not in the bubble, he's not even there to hear it.
Wow. Tell me, did you ever hear or see of any other inmates while you were there being released for compassionate reasons?
I never saw that happen once. I saw the girl who was in there longer. I mean, what concerned me was the girl who'd hurt herself playing the sports and had stayed there and they'd just not medically treated her properly to begin with. So she had complications and had to have more surgeries. So she's on a medical hold. It cost her, I think, almost an extra year that she had to be in prison on a medical hold until she could be treated sufficiently enough under their care that they're paying for, that they would release you. And I know the family was suing them, and it was an ugly situation. She got out just before I left, but she'd been there quite a while, and she stayed there so long because she had to get a medical release.
So what's your parting words of advice for an inmate actually in prison at the moment doing time when it comes to taking care of their own health and being proactive?
Take care of yourself, eat as properly as you can. A lot of us walked. We wouldn't do exercise. Well, they have gym classes where you can do step classes and you can do some exercise classes. They have weightlifting and some other programs that you can get into. They have treadmills, but you're in lines because there's a lot of people trying to use a few treadmills. Get to the gym, out to the track and walk. I would try to get 3 to 5 miles in a day. A couple girls, I literally watched a girl in my bus stop who was in for, now listen to this. So her boss in a hospital embezzled from the hospital. And at one point, this woman who embezzled gave this girl who did time a gift. I don't think it was a big gift, but a gift. And when they found out that they'd given her a gift and she hadn't reported the woman for embezzling, which I don't think she realized what she was embezzling, she had to do 30 days in jail, 90 days. She had to do So she comes in with diabetes. She's not in great shape. She's chubby. She walked and walked and walked. By the time she left, she was off insulin. She'd lost 45 pounds. She was a completely different person, happy, healthy, and her job felt so bad for her that they promised her when she came back, she could come back. But talk about a woman who was absolutely shocked this was happening to her life. And again, she was afraid. She's medically not healthy. But you can make yourself healthy, by exercising and paying attention to what you're doing and not eating a bunch of crap. I mean, they have chips and pop and everything else you can get. Don't do it. Don't start down that road. I mean, I never drank pop when I was in there, and I'm not a big chip person. If I'd have stayed away from the honey buns, I'd have been in good shape.
Thank you for listening to How to Go to Camp with Katrina McLaren and Cheryl Womack. For more support, check out the Women of Worth website, www.womenofworthwow.org, where you'll find helpful resources, including Cheryl's books, Mummy Loves You Everywhere and How to Go to Camp, Surviving in a Women's Federal Prison. Whether you're preparing for the journey or supporting someone through it, remember there's guidance, hope and a community ready to help you navigate this path.